Why tear trough filler goes wrong. Tear trough filler is often advertised as a quick treatment for under-eye hollows. But in reality, it is probably one of the most technically difficult filler procedures in aesthetic medicine. Swelling, lumps, puffiness and a tired appearance are more common than many people realize. So why does tear trough filler go wrong so often? The tear trough is the groove between the lower eyelid and cheek. It becomes more visible with age. Causes include volume loss, descent of the midface ligament tethering, genetics, skin thinning, orbital fat changes. Key point: not every dark circle is a volume problem. Why treatment is difficult. Thin skin. The lower eyelid skin is among the thinnest in the body. Even small amounts of filler may become visible. Minimal soft tissue coverage. There is very little tissue to hide filler. Constant movement, blinking and facial expression affect the area continuously. Complex anatomy. Important structures include orbicularis retaining ligament, orbital septum, malar septum, infraorbital vessels, lymphatic drainage pathways. This is one of the most anatomically complex areas of the face. Common complications. Swelling, probably the most common issue. Causes include hydrophilic filler, excessive volume, superficial placement, impaired lymphatic drainage. Tyndall effect, blue or gray discoloration caused by superficial filler, lumps and irregularities, often due to incorrect plane, excessive product, poor patient selection. Malar oedema can persist for months or even years. The biggest mistake: poor patient selection. Many patients are not ideal candidates. Examples: prominent eye bags. Filler may make them worse. Significant skin laxity. Often requires surgery rather than filler. If you want to understand facial anatomy, injection planes and complications in greater depth, these are exactly the topics we explore through Anatomy for Injectors and the Cadaver Dissection Workshop for Injectors. The biggest mistake: poor patient selection. Many patients are not ideal candidates. Examples: prominent eye bags. Filler may make them worse. Significant skin laxity. Often requires surgery rather than filler. What makes a good candidate? Typically, younger patients. Isolated tear trough deformity. Minimal eye bags. Good skin quality. Minimal edema tendency. Key take-home message. Tear trough filler is not simply a filler injection. It is a treatment that requires anatomy knowledge, careful assessment and careful patient selection. In many cases, the best treatment may be cheek support, skin rejuvenation, surgery, or sometimes no filler at all. If you want to understand facial anatomy, injection planes and complications in greater depth, these are exactly the topics we explore through Anatomy for Injectors and the Cadaver Dissection Workshop for Injectors.